Hi everyone, I'm Isabella Bulb, an LPN student at Northland, and I'm going to be showing you how to do a sterile wound change with sterile gloves, and I'm also going to be obtaining a culture. First things first, when you want to go do a wound change, we need to knock on the door, introduce ourselves to the patient, state why we're there, and then we need to identify and verify that the patient is who we want. They need to verify their full name and date of birth, and then you also need to ask them how prior wound changes have gone for them before, if they need or don't need any pain medication. I have gone through this with my patient already. He has had no prior pain medication with wound changes, so we are ready to get the ball rolling. First step I do is put on non-sterile gloves to take off the prior wound packaging. I do this to prevent any drainage that might get on me. In order to do this, we need to grab the tape and hold the skin down, that way we don't rip any skin. And we need to fold the tape inward toward the incision so that the tape adheres to itself and not the person again. And before we start anything, we have already washed our hands and made the area that we are working in very, very sterile. We also have Purell on hand at all times. That way if we do get any sort of dirty, we can Purell our hands right away. The next step, once we've finished adhering the tape to itself, I'm going to grab the wound packing. I'm going to grab everything that I can in one swipe. I'm going to observe what the packing looks like, the color, the odor, the type, how much. And then I'm going to take a mental note of that. I'm going to scrunch up all of that into one hand. I'm going to remove that glove with the wound packing in it. I'm going to put it in my other hand, and I'm going to remove that glove. That way the packing is more secure inside the garbage. I can go ahead and throw these away now. The next thing we're going to do is assess the skin around the wound. And then we are also going to assess the inside of the wound at this time as well. We need to look for anything abnormal. Again, wound type, color, drainage, amount of drainage. And then we're going to measure our length, width, depth, and obtain our culture at this time. So I'm going to go ahead and I'm going to get my length and width first. The length of our wound is about 8 centimeters. The width of our wound is about 2 centimeters. And to obtain our depth, we need to use a Q-tip applicator. This is in a sterile packaging, and there are 2 in them. We need to be very, very careful not to turn our backs on this once it is opened. And we also need to be very careful to not touch both applicators when opening them. Once I have this, because my wound is fairly dry, I'm going to slide my fingers down to where our wound meets our stick. I'm going to pull the applicator out, and again with my measuring tool I'm going to measure that. Our depth is about 3 centimeters. Now I'm done with that applicator, so I can go ahead and throw that in the garbage. Now I'm going to obtain my culture. I'm going to take my culture swab and I'm going to start at the top, innermost side of the wound, and I'm going to swirl my way down to the bottom. Next, I'm going to package my swab and get it ready to be taken down to lab for testing. Next, I'm going to get ready to begin packing my wound. First, I'm going to start with my compressed gauze. Now what I like to do so I don't forget it is I also like to put my saline solution on my gauze at this time. I palm the label, I twist off the cap, and keeping the cap facing downwards, I'm going to pour a little bit of the saline solution onto my gauze, put the cap back on, set my saline solution aside again. We want to make sure that it doesn't splash on any other packaging. That way it doesn't contaminate anything else. And then I'm going to continue on opening up my other packages. My next step is to open up my sterile gloves. Once I do this, I open up, it's kind of folded in a hot dog manner. I'm going to open it up and then there will be two tabs about an inch width that say to pull open. I'm going to grab that tab and I'm not going to let go of it. I'm going to gently glide my fingers upwards and downwards along the edges as to not contaminate the gloves. I'm going to then put on my right glove. Now I'm going to put on my left glove. And again, when we put on our gloves, we keep our thumb in hitchhiker's position. And then we also step back, just like before. Once we have gotten both of our gloves on, we can go ahead and reposition them on our hands as we need. And then we can go ahead and get rid of that waste so it's not in our way. Once we have our gloves on, we can go ahead and start packing the wound. So I'm going to take my first set of gauze that we doused in the saline solution. I'm going to grab a sheet, and I'm going to try to get it as untangled as possible, and then I'm going to wrap it around one of my fingers as it's easier for me to pack the wound that way. And then we are also going to grab our second Q-tip applicator. This is what we're going to use in order to pack the wound, that way we don't get our sterile gloves dirty. Once we have our applicator, we are going to pack our wound. We need to do this gently but firmly in order for the wound packing to stay placed. Once that is done, we are done with the applicator. We can go ahead and throw that away. The next step, we are going to take our 4x4 gauze. There is one set of these, so that means there's two sets of gauze, or two pieces of gauze. I like to go ahead and grab all the gauze at once with one of my hands and then grab the bottom piece with my other hand. That way I can take the sterile-most part of the gauze, which is the inside of the gauze, and set that on top of our packing gauze. Once we have done that, we are ready to grab our combine pad. Our combine pad has a blue stripe on it. This is the stripe that we want facing upwards towards us when looking at the wound. And then we are going to gently place that on top of the gauze so the gauze does not move. Once we are done with that, we can go ahead and remove our gloves. Again, doffing the gloves as we had before with our non-sterile gloves. We can go ahead and remove these and throw them in the waste now. Purell our hands again. And now we can go ahead and get out our pen. This time we are going to grab our 3 pieces of tape that we had set out prior. We are going to write the date, the time, our initials, and the patient name on one of the pieces of tape. That way, any nurses after you will know who changed your wound last, when it was changed, and the time it was changed. Once we have done that, we have completed doing our sterile wound change with sterile gloves. We have also obtained our culture. So now it's time to reassess our patient. We ask them how this dressing was tolerated, if they need any pain medication, how it felt during the wound packing, and any other questions that you might have for them or they might have for you can now be answered. Once that has been done, you can now clean up your mess and then go chart. Make sure to chart anything and everything that you saw, from skin to how they felt, the type, the odor, the color, amount of drainage that you saw in the packing, as well as inside the wound, anything that came out that was unusual. And then you need to also get your culture to your lab as soon as possible in order to not contaminate your culture and in order to get the best results. Thank you.